Welcome to Promis. I'm Robert Lefever, I'm the Director of the Promis Recovery Centre. Over the last 20 years we've treated something over 4,000 people with various forms of addictive or compulsive behaviour. The big three are alcoholism, drug addiction and eating disorders, but obviously we treat the patients and very often they have many different addictions at the same time. So we've got experience of treating all sorts of things, and what we hope in these talks is to be able to give you an insight into what we do and how we help people to get better. Controlling and helping. There is an arrogance to compulsive helping that is absolutely devastating. Because what compulsive helping does is to say, I know what's good for you. And my friend Bill Glasser, the consultant psychiatrist in California, says, if you ever hear that phrase from somebody, particularly government, saying, I know what's good for you, run! Run for your life! Because that person's going to cause you immense damage. Now, as far as young children are concerned, of course, we do, as adults, know what's best for them. We do try to give them some fear. We say, hot, 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 to try to stop the child putting a hand on the oven. We actually try to help children because we do know better. But as far as adults are concerned, no, we don't. And it's very difficult for compulsive helpers to learn that. I choose my friends. I got some right crazy friends. I got some wonderful friends. People who are absolutely off the wall. They're my choice. They're my mates. There are some things I do that people say, Robert, you're crazy. I left here on Friday night at 9:45. Last night I left at 5 and then had to come back between 8 and 10 to see a couple of new patients. And people say, but why don't you play golf? And I would say, golf? You think that golf is more fun than what I do? I love the work I do. I don't want to play blooming golf. But people would see me as crazy. But it's my choice. My wife works with me. My children are grown up. There's no downside. I enjoy it. Did you see the bit in the papers last week that showed that type A personalities do not have a higher risk of heart attacks? We always used to imagine that the people who were working on this, that and the other, and buzz, 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 had a high risk of heart attacks. They do not. It's folklore. It is not true. Phew, that was close. So what's the boundary between helping and compulsive helping? It's the arrogance. If I stand on my high horse and say, I know what's good for you, that is compulsive helping. If I'm doing something that was simply nice, I might pick something up that somebody dropped. I might, spend half an hour with somebody. I might go out of my way to just be nice to that person. That is normal helping. Now, it is possible, even for compulsive helpers, to be normal helpers at the same time. What we're not trying to do is to get the compulsive helper to be nasty. We're trying to help the compulsive helper to get rid of the two characteristics of compulsive helping, which is caretaking. That's way beyond caring. It's caretaking. It's being somebody's full-time caretaker. Because that person, you couldn't possibly do it yourself. I've got to do it for you. Well, that is absolutely stultifying. It will stop that person stone dead in terms of growth. We have to learn from our own experience. And the other characteristic is self-denial. Okay, I know it cost me another arm and a leg, but on the other side, I've got an arm and a leg and I can hop. We're not bothered about how much it's cost us, how much damage it's cost us. It's in a good cause. Well, that self-righteousness is appalling. It is so arrogant. People learn much better from themselves when we're not there doing everything for them. So, as far as compulsive helping is concerned, it is very controlling. It is trying to fix somebody else and also trying to fix oneself with a sense of needing to be needed. Well, that's not very clever. I can't get my self-esteem through someone else. either from what I'm doing for them or what I'm getting them to do for me. My self-esteem has to be based on my own actions, my own thoughts, my own feelings, my own reactions to other people. That's where my self-esteem comes from. And that's what we try to help our patients with here.